Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. We're glad you joined us this morning. Before we begin, I'd like to thank our sponsor, Aultman Health System. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Shannon, Urena of Aultman Medical Group Plastic Surgery. Good morning and welcome to the show.
Good morning.
All right. We'd like to remind our listeners that our program today will be on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
So, welcome to the show, Shannon. Please tell your listeners about yourself and your training.
Hello, everyone. Thank you for having me here today. I'm really excited to be on the show. A little bit about myself is that I graduated from Rutgers University in New Jersey on the East Coast. So I'm an East Coaster, born and raised. And I was trained in several hospitals, again, on the East Coast, with an emphasis on dermatology and plastic surgery and surgical subspecialties. And so this is my passion.
So tell us about Aultman Medical Group Plastic Surgery and what are the specialties?
Yes. So Aultman Medical Group Plastic Surgery does offer a plethora of services. So even when we say plastic surgery, it's not just what the outsider thinks. We offer cosmetics. We offer reconstruction, especially with women with breast cancer or men with breast cancer, any traumas to the face. So we have to reconstruct a face if they get a dog bite, anything like that, or a laceration in the emergency room. We also do hand surgery as well. And derm, of course.
Okay.
All right. Good morning, Shannon. Let's get started with today's topic. What is ultraviolet radiation and where does it come from?
That is a great question. Ultraviolet radiation is an invisible ray that it gives off energy from the sun. So it's typically what we feel when we're getting burnt, essentially, from the sun in the simplest way.
All right. So can you explain the difference between UVA and UVB rays?
Yes, those are the subsets of ultraviolet radiation. And so UVA is a longer wavelength and it penetrates deeper into the skin, whereas UVB is a shorter wavelength and it causes more of an instant burn. So UVB is more at the epidermal layer, whereas UVB again is longer, deeper layer, and so that's the more of the dermal layer.
So how does UV radiation affect our skin?
Yeah, so it can affect the skin in many ways. Essentially, in the acute setting, it can cause a sunburn. So a lot of people that you see on the beach that stay out for long periods of time, and then they have that leathery or red appearance. And then that can, over time, by multiple burns, cause facial aging or aging wrinkles of the face and can ultimately lead to skin cancer as well.
Okay. So let's talk about, I guess you kind of touched on some long-term and short-term effects. So anything else you want to talk about for short-term or long-term effects of continued UV exposure on the skin?
Well, one thing is important for the listeners to know is that obviously with sunburn, you can get redness. You're gonna definitely peel in the acute short-term setting. And so that's why it's really, really important to wear your sunscreen, which we'll definitely talk about later. And in the long-term realm is that not only do you get these effects from, wrinkling and damage to the skin and skin cancer, it's actually at the molecular level, it's causing oxidative stress. So it's essentially breaking down our collagen and elastin fibers, which is what keeps us young and plump in our face. So it's breaking down these molecules at that molecular level over time, and it's actually very harmful.
You know, there used to be a tanning salon on about every corner in the county, and you know, I can't even think of where one is anymore, and it just has really denigrated into, hey, let's not do this anymore, right?
Yes. Mm-hmm.
Okay, so can UV radiation cause eye damage? How can we protect our eyes?
So UV damage can absolutely cause eye damage. And so you can have a sunburn to the eye called photokeratitis, and it can cause pain, redness, blurred vision, teary eyes. And so the best way to protect yourself from the sun in your eyes is to get sunglasses that essentially have UVA and UVB protection, which were those wavelengths that we talked about earlier. So the shorter term and the long term effects. And now many places, even eyewear places, are offering the protective lenses. So it would be sort of rare now that we know more about it and protection that places wouldn't be able to offer it. A couple other things that you can get just to name out there are wider brim hats to protect you. I also have contact lenses now that have UV protective lens on it for those that don't want to wear glasses. And especially ones that wrap around the side of your eye because you're still getting UV rays that are coming through even when you're driving. So that's very important to note.
So how does UV exposure contribute to the risk of skin cancer?
Yes. So as we talked about earlier about oxidative stress on that molecular level, essentially, what happens is all of us are made up of DNA, obviously, and that DNA translates into mutations, right? When you're exposed to the sun and the UV gets to your skin, what the DNA does is it essentially gets disrupted and then it causes these mutations, and then those mutations cause further mutations and then lead to the ability for the skin to make skin cancer. And so it depends how many sunburns you've had over your lifetime or catching up to you, or sun that or UV rays that we didn't even know we were getting exposed to, because that can still happen even walking from your car to the inside of your work, or on a winter day that you don't think you're going to get UV rays, you're still getting the effects of the sun, or even in the snow when it's reflecting off. And so those are very important things. And again, back to the simple, most important thing is that it's just disrupting our DNA, and it causes these abnormal chemical bonds, and then it causes immunosuppression, and down the road you just end up with a skin cancer.
Mm-hmm. So what are the best ways to protect ourselves from UV radiation?
For prevention, essentially, it is the sunscreens. There are many types of sunscreens. There's SPF 15, there's SPF 30, there's SPF 50. So these levels correlate to how much or percentage blocks the UVA and UVB rays. So they increase as the SPF number also increases. So what's important is to, obviously, and we'll get into this later, when to use what types of sunscreens. And Another thing is the protective wear that we discussed earlier. So of course, the wider brim hats are important. Sunglasses that have the UVA, UVB protection. You want to also avoid tanning beds, which is what we discussed as well. I don't find many patients are really going into tanning beds. Obviously, there was a history of it, I find now, rather than still going into a tanning bed. Longer sleeves are important, especially clothes that have UV protection. Getting routine skin checks are important. Also avoiding outdoors during peak hours of UV. So the sun is strongest from 10 a.m. to 4 p.m. So obviously avoiding those time frames.
You know, our office where we are right now is on West Tuscarawas Street. We're right across from Aultman Hospital. And
Right.
there's a lot of sidewalks, okay, for people to walk on. And it kind of makes me crazy when I see a mother pushing a baby in a cart with no sunglasses on and no skin protection. What's with the eyes on very little children in a bright sunny day?
Yes. So of course, children's skin is obviously, I'm sure you felt a, tiny baby. They have softer, more gentler skin, and their skin barrier is just not as thick as maybe the other adult patients that we have. So yes, it's very important that they're wearing their sunscreen. And again, there are sunscreens that are safe for children and adolescents and that are hypoallergenic and are meant for sensitive skin. Really, parents should be avoiding sun exposure in children that are infants because this can be very damaging again as they're just so very sensitive. So, but it would be advised if they are going to go out or younger toddlers and whatnot, that they use these products that are safe in children.
Okay, time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters with the Medicine Center Pharmacy. Friends, just a reminder to stop by the pharmacy and talk to our pharmacist about your Health Matters membership savings program. We want to help you stay well and save money.
All right. Well, before the break, we were talking about all the scary things that UV radiation does to you. So how about we talk about how effective sunscreens are and what SPF we should use for different activities?
Great question. As I had mentioned earlier, there are different levels of sunscreen. And so they correlate to how much or percentage of the UVA and UVB being blocked. And so, for example, SPF 15 will block about 93% of the UVB. 30 SPF will block about 97%, and then 50 SPF will block about 98%. So as you can see, when you increase your SPF, you are getting more protection, higher percentage away from the UVB. Again, which is very important. And so it's recommended anywhere from SPF 15 to 30 is for everyday use. So that means if you're just simply walking from the outside of your car to the inside of your job or doing a quick in and out, that's what you would typically use. Now with a 30 to 50 SPF, you're going to want to use that for the beach, for the pool. Okay. And then anything 50 and above, you're going to want to use for example, higher altitudes if you're going to go on a big hike. Because you're going to be closer, right? You're going to be closer to the sun. Tropical areas, if you're going on vacation, where you may be closer to the equator and the sun is a lot hotter. So that's what you would be looking at in terms of what and where and how to wear it.
I think it's fascinating how sunscreens have evolved, frankly. I mean, just in my short time as a pharmacist, I know that there's been a lot of variants. And I remember when people didn't trust, when we originally had like SPF 30s and 45s and 70s and whatever, people like, oh, well, those don't work. Well, I think it's pretty amazing how well they work now. Recently we had a Caribbean vacation, my wife and I, and it was amazing. I just can't even get over how well they work when applied correctly, mind you. And I'm sure you might have some comments on that, but
yes, that's a great topic actually, because not many people know how to apply sunscreen or how much they need to apply. And there's often areas that we forget, right? There are our ears, our feet, our hands. A lot of people just will just apply to what they can see, their legs or their torso and things like that. But, importantly, I see so much skin cancer on ears or behind the ears, just because there are areas that were forgotten, or feet. I've seen that a lot as well. And so, I think the knowledge and the education of sunscreen has definitely evolved. There's many programs out there and advocates for the wearing of sunscreen. And so the recommendation is actually applying each time like a shot glass of sunscreen. So that's actually how much you should be putting on your body, if not more, depending on your surface area. So that's what's very important.
Is there a certain time of day that the UV radiation risk is the highest?
Yes. So again, anywhere from 10 a.m. to 4 p.m. is essentially the highest. Now, what's interesting is different parts of the world, or if you're closer to the equator, there will definitely be more or higher peak times as compared to perhaps us in the United States, right? So one way to check that is through the apps that we have, the free apps that we have available on our iPhones. And they can typically tell you how much UV is out there at that particular time. There's also another program through a free app, again, that I'll discuss later, but you can check what times are going to be peaked in a particular location.
Okay. What about, I don't think we talked about people with different skin types. Any considerations we need to think about there?
Yes, there are all different types of skin. Usually, many dermatologists or in plastic surgery will follow what's called a Fitzpatrick level. And Fitzpatrick levels are the skin tones or colors of the skin. So 1 through 5 to 6, essentially. So 1 is for very fair skin types. Those are the typically more pale. They always burn. They never tan. You either have red hair, blonde hair, and light eyes. And then it increasingly goes down. So 2 would be fair. 3 would be medium, 4 is olive, 5 is brown, 6 is very dark. And so, of course, the darker that we go, we have more pigment, so more melanin, it's called. And that melanin can essentially be protective against UV radiation, but it's not enough. So you can't just get away with not using any sunscreen at all, even if it's medium or light brown, olive, and very dark. There's a misconception there. And again, I don't want to spoil it for later, but yeah, there's misconceptions that, if you are higher Fitzpatrick, you don't need to wear sunscreen. And that is simply not true. But we do need to be very careful with lighter or lower Fitzpatrick levels because you can easily burn.
Yeah.
All right. Well, I think it's news time.
Oh, yeah. Okay. You are listening to Health Matters today, and it is the bottom of the hour. Time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. You are listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, we're talking with Shannon Urena from Aultman Medical Group Plastic Surgery.
I know you talked quite a bit about how hats can protect you from the sun's rays. What about the fancy clothing they make now that has some UV protection? Do you have any comments on those?
I think that they're great, actually. I think that we've come a long way, and we didn't used to have the clothing or the Under Armour for people who are playing sports or who are going to have a lot of exposure to sun or hiking, things like that. So I'm a big supporter of those wanting to wear UV protection clothing. I know it's something that's a little bit more newer on the market. And again, it's important to know that you can still get burnt even though you're wearing this protective clothing. So you really do need to apply sunscreen underneath the clothing and then put the clothing on, of course. And so highly recommend. I think it's important, especially in children too. Children that don't necessarily want to wear sunscreen and then they're fussy and they just get away from you. So you want to be able to make sure they have something when they're using or going out to sports. So very important.
Interesting. So I look at that stuff and I'm thinking it doesn't work. But it does work.
So it does work, but you do need to remember that it's not 100% protective, right? So you do need to apply your sunscreen while you're putting on the clothing, of course, and continue to reapply sunscreen. The clothing itself is not just going to protect you for the entire day. So that's why that's very important. Same thing, making bathing suits now that are protective against the UV B rays. And so you, of course, will still, there's going to be exposed areas. So you still need to apply the sunscreen on top of the clothing.
Okay. So, Shannon, what are the common myths about UV protection you'd like to talk to debunk?
How much time do we have?
Well, you got half an hour.
Yeah, there are many myths out there. One important one is that you can't get sunburned on a cloudy day. And so the reality is up to 80% of UV rays can penetrate clouds. So that means you can still get sunburn even when it's overcast. So again, always important to apply even in winter. Another important thing is that, as I mentioned earlier, the higher Fitzpatrick levels, our darker skin don't need to wear sunscreen. So again, while you are darker skin or olive skin tone, you may have more melanin, providing some protection. That doesn't mean that you're immune to sun damage. Darker skins can still get sunburned and are still equally at risk for skin cancer. And so sunscreen is essential for everyone. Another important myth is that you don't need sunscreen indoors. You do need sunscreen indoors because you can still get UV rays penetrating from the windows, right? Even when you're in a car, you'll see a lot more truck drivers or others that spend a lot of time in the car there, depending on what side you drive on, you're going to have more exposure on that side. And so another important one is waterproof sunscreen doesn't need to be reapplied. And so no sunscreen is completely waterproof or sweat proof. So water resistant sunscreens need to be reapplied every 40 to 80 minutes, especially after swimming, sweating, or towel drying.
Okay, now we see anti-sun preps, spray, lotion. What about the sprays? They're just kind of come along here, not too far back. Are they effective? They're more liquid than like a lotion, sun protectant.
So there are obviously many, many sunscreens out in the market. There are sprays, there are lotions. Obviously we recommend the ones that you can apply kind of more of like a lotion base so that you really can lather and get into areas that you need to. Sprays, sometimes the actual sunscreen is lost in the air and you're not really spraying. They're either spraying too close, they're spraying too far, and so there's loss of the actual protective sunscreen in that. Now there are some sunscreens that carry, chemicals that particularly one that comes to mind is the oxybenzone, which is very harmful to the water, harmful to the coral reefs, causes oxidative stress. So some of those sprays do carry that, and it's important to note not to get ones that have that in it.
Also, there's a skin condition, I believe, called a keratosis. Am I close there?
Yeah.
Precancerous. And are they produced by the sun?
Yes, they are. And so it's kind of like the stage right before true skin cancer can evolve, right? So at that point, that your DNA has already been damaged and you've already got burnt and the skin is starting to show signs of change.
So okay. Reason I bring this up.
Sure.
I had one many, many a year ago on the left side of my face, which of course is the sun side when you're driving a vehicle. Okay.
Right.
And of course I don't wear sunscreen driving a vehicle. So what do you do with these guys?
So with the actinic keratosis, a lot of times the dermatologist will actually freeze the lesion in their office. So we don't typically do very much from a plastic surgery standpoint. But the dermatologist, this is why they're very, very important in the role, is because they can freeze these lesions, meaning preventing those cells from evolving even further than they already have. So that's with liquid nitrogen
Yeah.
And again, that's what they would do. Now, there are some plastic surgeons that carry lasers or ablative lasers. And of course, it's a different form. It's like a heat instead of a cold, and that can essentially try to stop the progression of this going any further. It can cause some sloughing on the skin. It can cause you to scab. And so that's what could help prevent it from going further.
I was listening to a medical show the other day, and this subject came, and I forget who it was, the doctor, but or the nurse. If you get a keratosis, you better get that baby taken off right away. Now,
Yeah, I mean, there are some that really do believe it's necessary to remove before it becomes something. I think, it's just all dependent on the history. Everybody is different, right? So if you've had a history of multiple skin cancers and this is just not looking good, and you can already predict that this needs to come off, then it would probably benefit to have that discussion with a provider and come up with a plan. Also, if the person is also covered in skin cancer, which that does happen, and they have skin cancers all over their body or actinic keratosis all over their body, right? You can't essentially laser and freeze the entire body. So you
yeah.
have to come up with a plan or excising every lesion, right? So at that point, it becomes a plan, and you need to assess which one is the worst, which one can evolve quicker at that point, and what would benefit the patient at the end of the day.
Okay, on a cloudy day, what it, now how do I ask this? Okay, a sunny day, you get a sunburn. Cloudy day, you still can get a sunburn. What's the percentage of difference between those two types of days on sunburn?
They are essentially the same. You can still get, obviously, a sunburn via both on a hot summer day and on a cloudy day, because the UV ray can still go through that cloud 80%, up to 80%. So
Wow.
that's still the sunscreens that we have available, they're blocking up to 96-97% of UVB. So you can still get just as sunburn, especially, for example, this is a great point, is those that want to go skiing and it's snowing out. The reflection of the rays actually is higher because it's reflecting off the snow. So
Wow.
yeah.
Okay. Shannon, our last break is here. You are listening to the final break, excuse me. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Okay, welcome back to the final segment of Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Pharmacist Brad White, and I thank you for joining us. Let's get back to the last segment of the show. I think your question's up, Brad.
Yeah, I think one last thing. Shannon was going to talk about an app that you could use. Is there something you wanted to mention about UV apps before we talk about other things?
Sure. One important one that we have is, of course, the one that we have on our iPhones. If you have an iPhone, through the weather app, it'll tell you how much UV radiation you're being exposed to and the location that you're at. Another second one is called SunSmart. It's a free app. It detects the solar UV at a specific location. It'll give you time slots. So it's important if you're traveling or you're going away with your families on vacation, and it'll tell you when to continue to apply the sunscreen. So it's right there at your fingertips.
All right.
Interesting.
So what role do public health campaigns play in raising awareness about UV safety?
Well, they provide accurate and comprehensive information. They typically will give you information about the risks of UV exposure, sunscreen, which ones are important to wear, and for what activity. Uh, they discuss skin cancer, and there's more awareness about it and how to detect it and how to prevent it, of course. There's also discussion about premature aging, which nobody wants. And
Well, you're supposed to be able to fix that though, aren't you?
yes.
Okay. All
Uh,
right.
and then also eye damage, which is what we talked about as well. So there's a plethora, and again, it's really important to follow the public health campaigns. One important one is the World Health Organization. They're the ones that actually created the SunSmart app that I had recommended earlier. And again, it's a free app and anybody can use it. It's pretty self-explanatory, and it helps you and tells you when and what time, and gives you a lot of information.
So I'm guessing, given your experience, you have some favorite sunscreens. Are you willing to share those?
Yes. I actually love the La Roche-Posay line. They are categorized under L'Oreal, and they also have a sister company called CeraVe. These are #1 dermatologist recommended. And the reason why I like these very much is that they offer broad spectrum coverage. They have higher SPFs available. So they have different formulations. They are very cognizant about sensitive skin types, which we do have a large population that have sensitive skin types. And they're even very important. There's a lot of research in our population that have breast cancer, so it's safe to use in that population as well. For our more cosmetic patients and preventative measures, these are non-comedomic, which means that they do not clog the pores. And so that's very important for
Say that word again.
non-comedomic.
Okay. Wow. Never heard that one.
Yeah,
Okay.
yeah. So it's just a fancy term that essentially it says that it prevents from getting pimples, and clogging the pores, or blackheads or whiteheads, that kind of a thing.
Uh,
Fragrance free, so there's no perfumes to it. So again, back to the hypoallergenic. They're efficient. They have all the safety standards. They're compliant with even international standards. There's so much research, and you can get it. You can get it over the counter. One of the major places that I send the patients to is actually Ulta. They're the beauty store. You can find a large line of the CeraVe and La Roche there. You could get it at Walgreens, Rite Aid, that kind of a thing.
Rite Aid's gone.
Well, yeah, it is. I shouldn't be saying that.
Yeah. You can probably get some of those products at the medicine center pharmacy too.
Do
We
you
do.
have them?
We do have CeraVe products of sorts. So
Great.
very popular line of skin products.
Okay, well, I
Okay.
will send them your way.
Okay. I don't know that we have the whole line, but we have some products. So
I'm
anyway,
sure. Yeah.
okay.
All right, so plastic surgery plays several roles in treatment of skin cancer, primarily focusing on the removal of cancerous tissues while aiming to preserve the function and aesthetics. How do you and your colleague, Dr. Lopez, treat skin cancers? Can you walk us through the process?
Sure. Typically, we'll get a referral from the dermatologist that has essentially biopsied the area. So that tells us what kind of skin cancer they have. Once we know this, we'll go over, of course, the pathology with the patient. We'll do an exam and we will give patient education and we'll tailor the visit to what will serve the needs of the patient and as well as curative and do a treatment. So typically all skin cancers should come out. And so we do then have a discussion about surgical intervention. Depends again what kind of skin cancers. Some are less invasive than others. Some are very invasive and need more attention and in a very quick way. So we'd have to get them scheduled for surgery a little bit faster. And then we determine again whether or not this could be done in the office.
So, what are some of the primary recommendations you give to patients to protect their skin following a skin excision?
A great question. So it's very simple. Let's say we do a removal in the office, after 24 hours, they'll of course have stitches and a Band-Aid or a bandage. We'll tell them they can remove that and then they can shower over it with soap and water, pat everything dry, only use a pea-sized amount of Vaseline. We don't really like the antibacterial topicals like bacitracin or neosporin because it can be very irritative to the skin after 48 hours. So we just don't do that. And then, of course, try to keep it open to the air. If you have it covered all the time, it can trap heat. So that's not great either. You don't want anything too moist or too dry. And so there's a sweet spot. And so we just say, keep on monitoring, put a little Vaseline, and that's it. Of course, scars long term down the line. We do recommend always putting sunscreen on that area because those areas can be darker pigmented with exposure, especially on a scar. Also important to know, we do discuss scar management. So we discuss utilizing vitamin C serums on there, which help prevent that oxidative stress I was talking about and that inflammation. And it's the only thing that we know that will help lighten and brighten scars. You do have to be faithful to it over a long period of time, at least minimum 6 months to notice a difference. Lastly, again, scar management with massage to try to break up any scar tissue, which is very important.
Getting a little tight here, Brad, aren't we?
Yeah, we
What-
are getting tight. Maybe it'd be a good idea for you to list your contact information and how to get a hold of you. And also, any closing thoughts that you have that you want to make sure that the listeners are privy to before we wrap up.
I think that they know now to wear their sunscreen. Anything is better than nothing, and knowing to use at least a shot glass size each time you apply. Knowing that the higher the sunscreen SPF number, the more protection you're going to get. Just being aware of accurate information and going to the World Health Organization or going on our FDA website is very important. Just make sure you're getting information that is accurate from a licensed provider as well is important, and making sure that you follow these steps because it's it can be invasive to go through. And so that's pretty much it, but you can find us, my colleague and I, at 6046 Whipple Ave Northwest in Canton, Ohio, at entrance D. And our number is 330-499-2209.
2009.
2209.
Okay. I guess we're out of time. Thank you very much, Shannon. Urena, we enjoyed the topic. Physician assistant certified with Aultman Medical Group Plastic Surgery. If you suspect you have a medical issue, please contact your healthcare provider. Thanks to Aultman Health System and their listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC. Thank you very much, Shannon. It was very interesting.
Thank
Have
you
a-
so much.
Have
Thank
a good
you.
day.
Have a good day.
Well, take care. Bye-bye.
Yes.
Bye bye.